In absolutely tragic news, a junior Russian hockey player, Timur Faizutdinov, passed away after being struck near the head by a puck in a game a few days ago. Welcome back, everybody. I'm Dr. Brian Sutterer, and this is your #1 source for learning about the unique medical side of the world of sports. When something so tragic and unexpected happens, I naturally get a lot of questions on the channel about how something like this is possible. How did it happen? You know, athletes who play hockey and are now afraid of what could happen to them. So I want to talk about this situation because first off, there are things that I take away from a story like this that I hope will help me provide better care for athletes in the future. And also because I think it's important for sports fans and athletes in particular to be more aware and have better understanding of when tragic things like this happen in the sports world. This is the play where he got hit by the puck, and you can see it come up here and basically strike him around the head or maybe even a little bit on the neck, kind of down below the ear. It's hard to know exactly where the puck struck him. We can see him grabbing at his head right away, so presumably there was some contact to the head that was causing this pain. And the reports have mentioned things like fracture of the temporal bone, cerebral hemorrhage. His family mentioned something about injury to the carotid artery, all of which are structures around that area where the puck could have struck. If we look at our biodigital anatomy tool of these relevant structures, we can see these different blood vessels and that temporal bone. So here I've removed one of the different pieces of the skull, and what I have highlighted now in yellow is that temporal bone. It's actually quite big and extends into the head to form sort of part of that skull base where the brain is ultimately going to sit, kind of in the cranium here. The ear is here for reference, and so if you imagine basically a hockey helmet around this area, that temporal bone is pretty exposed, right? Kind of where we talk about our temple. Now, of course, if we go lower down in the neck, we're going to have the carotid artery. And remember, arteries are sending blood from the heart to the structures of the body. So here, the carotid artery is sending blood from the heart up to the brain to deliver oxygen, nutrients, and so on. The carotid artery is the pulse that you can feel on your own neck. And so while it may seem pretty deep, it's superficial enough that a blow to the side of the neck could cause injury to that blood vessel. That common carotid then splits into the external carotid, which is going to come more on the outside of the skull to supply blood to the face. And then the internal branch of that carotid artery is ultimately going to travel up inside the skull and branch into one of the blood vessels that supplies blood to the brain. Now, whether or not the puck hit the bone and broke the bone or hit in the neck and broke the neck, essentially the downstream effects can be the same in terms of limiting the blood supply to the brain or causing severe enough bleeding in the brain. And that's that cerebral hemorrhage. Cerebral meaning brain, hemorrhage, of course, meaning bleeding. The brain is extremely sensitive to any decrease in blood flow. And so if that blood flow is cut off or limited for a long enough period of time, you can get death of those brain structures. On the other hand, if you have bleeding inside the brain, that blood can accumulate so much that it can push on different structures of the brain, causing something known as herniation that can then shut off the different areas of the brain that are important for things like breathing and control of things like your heart. Now, it is possible for a fracture of this temporal bone to damage that carotid artery supplying blood to the brain, but is pretty rare. If you look here, you can see that carotid artery really branches up into the brain right near the end of that temporal bone. And so if there's enough trauma pushing into that temporal bone, pieces of it can damage this carotid artery. But there's also, of course, other bones in here in the skull. This sphenoid bone, that carotid artery runs right alongside it. And so any trauma or fracture to these bones of the skull or of the face can cause these injuries to the blood vessels. And even if the puck just hits somebody in the neck, you can have dissection of that carotid artery. You can have blood clots that can form, it can tear. And so even just a hard enough hit to the neck can cause enough upstream effects to the brain to be really serious. The medical staff was out on the ice nice and quickly. They got a cervical collar on him, got him on the backboard and off the ice to the hospital. In these situations, we're always thinking, number one, is there a pulse? Is the heart beating? Are they in cardiac arrest? If not, we got to do things like CPR, get that defibrillator, and then we start thinking through the things like the spine and other possible injuries. You know, a typical hockey helmet that people wear doesn't really cover all those different bones of the face. There certainly is not much protection up to the neck, and there's limited covering kind of around those bones by the ear. One thing I hope medical providers and equipment manufacturers take from this is trying to look and see if there's any changes that could be made with the equipment. You know, we're not going to see people in like a full football helmet out there on the ice, but is there anything with providing some additional coverage around the ear? Is there anything with lowering or extending the helmets down a little bit further that potentially could make a difference for something like this in the future? Whenever you're dealing with damaged blood vessels, skull fractures, brain bleeds, These escalate beyond sports injuries. These turn into traumas. These turn into neurologic type emergencies. And unfortunately, despite the best medical care that's available at times, this happens. There's probably been thousands, if not millions of people who have been hit by a hockey puck over the years, whether it's in the helmet or in the neck or a stick in the neck, that have been totally fine. So for something like this to happen, where a puck just hits so imperfectly to cause this type of outcome, it really is such a 1 in 100 million kind of thing. What I take away from situations like this is, first of all, is there something that maybe I'm not prepared for when I'm covering a sporting event? I've been at plenty of hockey games and I've had people get sticks to the throat. I've sent people to the emergency room in the ambulance. And so I'm always trying to do the best that I can to be prepared for any and all type of situation that I might encounter. While almost certainly nothing was done wrong here, it forces you to basically reassess those steps in that process that you would go through to make sure you would be prepared to do the best you can in a situation like this. I think if you're an athlete watching this, the number one takeaway should be the importance of your protective equipment and safety in your sport. I know in hockey especially, there's a lot of people that don't want to wear eye shields. And while an eye shield didn't make a difference here, there are going to be plenty of times where a puck could come to the eye and an eye shield could make the difference in your vision or not. This is why we get so worried about head injuries and things like concussions, because we know as doctors that these are the possible outcomes that could happen, and it's why we're so diligent and why we worry and stress about these so much. This is why we talk about player safety. This is why this all matters so much. If you're an athlete who has a head injury, don't try to hide it. Be upfront with your team, be upfront with your medical staff. Don't try to cover up and hide these types of things. Every time an athlete steps onto the court or skates onto the ice, you're assuming a certain level of risk that's coming with that sport you play, whether it's an ACL tear on the basketball court or a spine injury on the field. It's our job as medical providers, coaches, staff, to keep athletes away from those situations as best as possible. But at the end of the day, unfortunate bad stuff is still going to happen. I think it's important to acknowledge and be aware of these risks so that all of us as a collective whole can do the best we can to take care of ourselves as athletes and provide the best care we can to our athletes. I hope this video was helpful for you all and that there's something that you can take away from this just truly unfortunate, tragic situation. My thoughts go out to Timur's family, friends, teammates, the players on the other team who were involved in this, and I hope these situations continue to be very few and far between. That's it for the video, everybody. Thank you as always for watching. Let me know any questions or comments down below, and until next time, we'll see you later. Bye.